to join us. Thank you so much as you put that in the chat session. You're welcome. Let us know if you're just joining us for the first time, or you've been joining us right from the beginning of the webinar series. Hi, Peter from Nigeria. We're glad to have you on call. Hi, Josiah from Ghana. Such a pleasure to have you on the call today. Hi, Carissa from Kenya. Thank you so much for being a part of today's session. And we believe it's going to be another amazing, insightful presentation. Hi, Mokadi from South Africa. Thank you so much. Rachel from Nigeria. We're excited to have you on today's call. Let's keep it coming. Let's keep it coming as we wait for others to join us. Hi, Flavia from Tanzania. Great to have you on the call. All right. Let's keep that introduction going. Putting your LinkedIn URL into the chat session. Let's keep connecting. So this webinar is being live streamed at the moment as well on YouTube. So if you have any of your colleague who wants to rewatch this, they can go to our YouTube channel, Digital Health Africa, and rewatch the session. You don't have to re-register again. It's the same link we've been using right from the beginning, so you don't have to re-register for the upcoming sessions. All right. So very quickly, I will just introduce DHA. We've always been doing this for the past two sessions, so you understand the organizations who are behind this initiative. So at Digital Health Africa, DHA, we're a media organization, and what we do is to, give insights and tailor our content and programs to ensure that we're promoting the digital health agenda in Africa. We leverage on data, on dialogue, advocacy to push digital health narrative on the continent, and in collaboration with Africa Canada Artificial Intelligence and Data Innovation Consortium, which is a consortium and in the global south that wants to establish a multi-regional network to deepen the understanding of how responsible AI solutions can improve societal preparedness for future global pandemics and climate disaster. And they have projects and different initiatives and academic work closely with government, public health agencies, civil society, and other actors. And now they are collaborating with DHA to actually put up this AI in healthcare webinar series for healthcare professionals and enthusiasts within the sector. So for us, why did we set up this webinar series is to upskill our healthcare professionals to understand emerging technologies, to foster an understanding of the unique healthcare challenges in Africa, and to empower healthcare professionals and healthcare enthusiasts to develop innovative solutions, and as well to bridge their skill gaps within the workforce capacity development. So today with us, we have an amazing guest, our facilitator, who will be taking us through this session 3. His name is Dr. George Obaido, and he's a research scholar, University of California, Berkeley. He's currently, he has completed his PhD in computer science at the University of Witwatersrand in Johannesburg, South Africa. And his research interests lie in using machine learning to find solutions to problems of societal importance. Hello, Dr. George. If you can hear me, you can just say hi.
Hi, thank you so much for the introduction.
All right. So let's dive right into the session. Thank you so much. Over to you, Dr. George.
All right, thank you. Okay. Yeah, thank you so much all for joining. I guess you're joining from different parts of the world. I'm so excited to meet you all. And of course, I guess after the session, we should all connect via LinkedIn. Right, now I will just jump straight to the presentation. So today I'll be talking about, just a gentle introduction to healthcare data. And over this presentation, I'll run you through just a gentle introduction to healthcare data, the importance of data in healthcare, as well as the different types of healthcare data, several challenges, in managing healthcare data, the data security and privacy concepts, as well as, we'll conclude afterwards. Right now, I mean, there's a digital revolution in healthcare currently, which is obviously unfolding globally. And this is marked by a surge in data across all aspects of our lives, with obviously seemingly no end in sight. You can see that, I mean, humans have been transformed into digital profiles, I mean, daily through new devices, different apps, even monitoring technologies, that helps one to basically track, analyze, and store vast amount of data. And I mean, if you look at your mobile device itself, you get to see that if you've been to several locations, at the end of the month, Google can send you basically your footprints where you've been to during the course of a particular time period. Right now, and even this data is mostly being aggregated and mostly used by, of course, AI to sort of make a couple of prediction. And of course, healthcare data, simply encompasses information about individuals' health or patient status, services or medical services they receive, and as well as the treatment outcomes that result afterwards. And this is very essential because it leads to critical, decision making, and it also helps to improve patient outcomes, basically outcomes as a result, and also tends to advance medical research. And of course, there are several types of health-related data. This data can range.
Are you sharing your screen? Your screen is not being shared.
Oh, really? Oh, no. Sorry about that. I shared before the session. Oh, thank you, Jude. Sorry about that. Okay. I guess I'll take that again. Right. Now, so like I said, healthcare data simply encompasses information about patients' healthcare health status, the services or medical services they receive, their treatment outcomes, and so on. And this is very essential. And why is this important? This is important for decision making. It's also important to improve patient outcomes, as well as also to advance medical research. It is important to have data. Data is very, very vital. And data encompasses different types. So it can range from electronic health records, also medical imaging, as well as genomic data and many other types of data that are mostly being aggregated on a day-to-day basis. Now, just this very snapshot of an example of basically an unstructured or structured data. Here you have a sample electronic health record of a patient, and in here you can see, the chief main or complaint that this particular patient had. So it can range from, headache or neck stiffness, maybe the medical surgery or surgical procedures that was carried out on this particular patient. And it can basically be a central line or arterial line placement for those that are in the medical field. I guess this is, you would simply understand what all these terms are all about. And also detailed history of the particular patient's, present illness. So let's say the present patient had a particular illness over time. That is or can also be aggregated. So basically their history prior to visiting the hospital, as well as even their recent medical treatments that they've undergone over time, as well as their past medical record. So let's say in the past they've had chronic back pain or MRI that have been carried out, as well as even their social history. Let's say the patient basically live, in a small size home or in a particular apartment, and so on and so forth. So these records are very important, even to a medical practitioner. And the fact that they're important, electronic health record like this are commonly used in different healthcare settings. So here you can use it to document, to manage, and also to track patient care. And they serve a comprehensive database for all pertinent patient information, which can be accessible to authorized healthcare providers. Now, data is very important. Data is central to, if you are an AI practitioner and you work in healthcare, data is very paramount. Data is very important. You cannot make evidence-based, or carried out of evidence-based medicine without data set. I mean, data is critical. I mean, in our lives, in our day-to-day life, not just in healthcare, in several other industries. But it is very central because it facilitates evidence-based medicine. I mean, with data, it has shown that vaccination program being implemented globally has reduced human papillomavirus virus, and substantially and even globally. Data itself can also facilitate or enable personalized healthcare. In here, analyzing data, healthcare systems can simply tailor treatments to individual patients, leading to more effective and also more personalized care. As well as data also improves patient health management. So in here with patient management, it helps to ensure comprehensive data can help achieve better patient monitoring, predicting, as well as managing patient health statuses, which can also enhance their outcome. And data also is very central, and it helps to enhance healthcare efficiency, and it also helps to reduce costs. So unnecessary waste can be avoided by data. I mean, data helps to streamline operations, optimize resource allocation, and even thus reduce or cut costs significantly. Now, healthcare data can range from different types. You have healthcare data that can be structured, unstructured, or semi-structured. Now, with structured data, these are mostly data sets that are mostly aggregated in a relational database or in a relational table. They are mostly organized and easily searchable. And for such kind of data, simply electronic health record fall under this category. There's also laboratory results and even vital signs. Mostly all these kind of data sets are usually organized properly. Why is this important? It helps to facilitate efficient retrieval, and even for decision-making, it is also very, very vital. Now, on the right-hand side here, you can see an example of a structured genomic data. Why is this data set important? For a medical practitioner, it simply helps to show the relationship between the single nucleotide polymorphism and a phenotype in the case of predicting the presence or absence of cancer. Now, for an AI practitioner, such kind of data can help. You can basically train machine learning models or you can apply these models on this particular data set to predict cancer-related status. So your outcome can be, or would definitely be, the phenotype, and the sequence would be your variables. Now, for unstructured data, this obviously introduces a higher level of complexity. Now, with unstructured data, this kind of data sets are usually not easily searchable. This stemmed from physician or clinical notes, X-ray kind of data, and many others. Now, why is this important? It basically contains valuable clinical insights, and it also helps to mostly advance, you can, use advanced processing algorithms like computer vision or even natural language processing to generate or to get insights from this kind of data set. Now, with chest X-ray radiograph in here, fundamentally, it helps to mostly diagnose a disease. You can also do monitor disease progression over time. You can also detect, abnormalities that can happen as a result by scanning the chest, the spine, the sternum, and so on and so forth. Now, the usefulness of this kind of data sets, if you integrate multimodal natural language processing models, especially currently now that large language models are simply all over the place, in here, you can integrate both text and visual images or images, to mostly carry out prediction. And with multimodal models like your DALL-E, for most of you who are familiar with large language models, you can mostly train them on this on X-ray images and even clinical notes to be able to ascertain disease comorbidities. So what do I mean by comorbidities? Comorbidities are mostly diseases that are mostly associated together. So let's say, if a patient have diabetes, then they can be predisposed to other types of diseases. Right now, when you train multimodal LLM on this kind of data sets, different types of multimodal LLMs that you can train, you can use Elava, even GPT-4 or GPT-4o that is currently out there. You can train these models together to be able to mostly carry out prediction. Now, aside on structured data, there is also semi-structured data. Now, with semi-structured data, excuse me, this refers to data that does not adhere to a particular rigid structure, just like a structured data set. They mostly have properties that makes it easier to analyze than unstructured data. Now, typical examples of data set that appear in these particular categories, you have healthcare protocols, electronic prescriptions, and so on and so forth. So they are mostly available in different formats, so extensible markup language formats, or even JavaScript object notation formats. And these data sets are mostly aggregated in this way. Now, why is this important? It offers flexibility, especially for capturing complex data types and also for structural analysis. So you want to carry out some form of analysis with this kind of data set, they're mostly very useful. Now, for those also in the medical field, if you're familiar with medical billing and coding, these data sets are mostly aggregated in this kind of format. Now, if you look at the code on the right-hand side, this is basically an XML document of a healthcare protocol, for managing diabetes mellitus. And this information shows, protocol information about the protocol name, the description, the patient information, the treatment plan that was mostly carried out, as well as the patient monitoring information. And in here, it helps to, capture the blood glucose level, the blood pressure, as well as the patient's weight. Now, aside saying all this, I haven't looked through this. It's important to also analyze that, healthcare or data sets in healthcare comes with so many challenges. Now, for those of you also familiar with the big data concepts, there are 3 essential V's in big data. And they mostly refers to the significant characteristics of, that describe the nature and challenges of managing big data. The fact that healthcare data is mostly aggregated over time, it comes with so many challenges. And this challenge range from volume, as regards volume, healthcare data set is generated at an unprecedented rate due to advancements in medical technology. So as you visit the doctor, data set is being aggregated. If a scan is carried out on you, there's a data that is generated. If it's treatment plans that are recommended to you, data set is being generated. So can you imagine, the population of the world and those, look at those in the hospital, those who visit the hospital on a day-to-day basis, those who leave the hospital. So you can see that at this rate, data would definitely be generated. Now, the volume itself comes with, like, a significant challenge. Having to store this kind of data set is, requires significant requirements. Data also comes in different varieties, so different flavors. So it's, it poses a lot of challenges, especially with interoperability, in terms of also data integration, and also in terms of standardization and exchange. Now, structured data sets, like I said, I mean, they are easy to store, easy to manage. You can get to see, the patient's age, the patient's gender, the patient's blood phenotype or genotype, rather. You can get to see all corresponding information. Now, unstructured data itself, comes with a lot of complexities. And the fact that unstructured data comes with these, huge challenges, it becomes very difficult to store this kind of data, because I mean, just imagine a clinician having to document a note about a particular patient. So usually these texts do not follow a particular structure. And of course, you need advanced natural language processing system to be able to handle such kind of data. Now, this set also comes with high velocity. Now, as regards velocity, the handling of this kind of data sets, such is generated and also updated in real time. Real-time processing needs to be carried out. Real-time analysis needs to be carried out to support timely and clinical decision-making and patient care. So at a particular velocity, it is accelerating, of course, even with your wearable devices. For those of you who use wearable devices, you mostly see that, as you take series of steps, data is also being generated. So data gets generated at continuous streams, and hence it poses significant challenge, especially to manage such data. Even with the security and privacy of this data set. Now, as regards the security and privacy, it also poses a great deal of challenges, because you wouldn't want patients' data to be exposed or to be exposed to unauthorized individuals. Hence, even different data regulations, which I'll talk about in the next slide, have been introduced by different organizations. So be it HIPAA here in the US, there's also GDPR, NDPR in Nigeria, POPI Act in South Africa, and so on and so forth. Now, a typical example of a cyber threats that have affected health data. For those of you who know, who got to know about WannaCry. WannaCry was this was a ransomware that affected many UK NHS hospital, and this affected. I mean, it was a global problem, a global cybersecurity crisis or problem. And it affected about 200,000 computers. This number of computers were affected as a result. And that made the computers unusable. One cannot process any data. And that posed a great deal of challenge, especially to the patient and also to the establishment themselves. So what happened as a result? Hospitals, yes. Was someone talking? Okay. Hospitals and clinics were forced to turn patients away and also cancel appointments as a result, because the ransomware encrypted data and also infected many machines, which of course demanded ransom payments to simply unlock them. And of course, there's other issues that has happened as a result of unauthorized breaches that has affected many hospitals all over the world. I mean, if you know of any that has affected where you are, it will be interesting for us to learn about them. Now, having said all this, it's important for us to consider security as a measure. Now, data security and privacy is very essential. It's very paramount in healthcare, because as a result of this, one can conduct or protect sensitive patient information, to ensure patient trust, maintain regulatory compliance, and also safeguard against any potential data breaches. For data regulation compliance, there are several organizations that govern the handling of this kind of information. For here in the US, we have an organization, a regulatory body called HIPAA. HIPAA is basically the Health Insurance Portability and Accountability Act. So this is mostly a federal law, that the United States have set up to ensure the protection of sensitive patient information. There's HIPAA. With HIPAA, all organizations, all medical centers must be compliant. They must ensure that, they safeguard patient privacy, maintain data security to avoid costly penalties. There are, for those of you in Europe, there is the GDPR, which is basically the General Data Protection. With the GDPR, General Data Protection Regulation, this organization ensures the protection of those within the EU region, and it helps to they mostly provide guidelines, data protection as well as privacy and consent of who should have access to what data. Nigeria is also, Nigeria has also come up with theirs. There's the NDPR, which is the Nigeria Data Protection. For South Africa, they have POPI, which is Protection of Private Information Act. New Zealand also has theirs, which is the Health Information Privacy Code, and so on and so forth. There are so many, each country have theirs. Canada also have theirs. I think I read about them a few days ago. It's basically the Personal Information Protection and Electronic Document Act, which is called PIPEDA. So they mostly govern the collection and use of personal information, and all private sector and public sector must adhere to, to ensuring patient privacy. Now, having said this, it's also important to encrypt and perform data anonymization. As regards this, ensuring encryption of patients' data is very paramount. With this, this can help to mitigate the risk of breaches that can happen as a result. And it's also important to also perform, pseudonymization. With this, you can mask, or remove identifying information from patient data. Now, why is this important? It's important to ensuring that the name of the patient is not disclosed, and every information that that reduces who that particular patient is to unauthorized individuals. Right, even to authorized individuals. Such information must be maxed out. Now, aside that, there's also access control and audit trails. With access control, even with your mobile devices, as well as even with your banking applications, you can say that, for you to log in via them, there is multi-factor authentication that has been, introduced. Similarly, with health information, they mostly have undergone multi-factor authentication. And the concept of the least privilege. The least privilege is if you are not authorized to view that particular data, you should not get access to it. So that's the concept of the least privilege principles. And with these principles, all these three ensure the strict access control, and they've also helped to prevent unauthorized data access. Who shouldn't have access to this kind of data should not get access to them. Now, in conclusion, data itself is a valuable resource. From our day-to-day life, if you're a machine learning technologist, data is very vital. If you are a clinician, data is very vital. So If you're a student as well, data is very vital. Now, the data as a resource is valuable. And the fact that it's valuable, it helps to improve patient outcomes, advance medical research, come up with effective decision-making, and so on. Now, for those of us in AI, this is also very vital. And one thing, as an AI expert, it's important to consider that when you create these technologies, you're not creating them for yourself. You're creating them to aid the work that a physician does. It does not make you a medical doctor. You're just there to assist the work that a physician, does. So this is important to consider whenever you're creating such technology. With AI technology, they can help to leverage this kind of data to enhance better, healthcare delivery, and also ensuring such data. It's important for one to carry out data security and privacy in order to reduce reduce those who shouldn't have access to this kind of data. Should obviously simply not have access to such data, because data breaches can expose personal information and significant privacy violation. So ensuring data security and privacy is very crucial in the entire digital healthcare ecosystem. So if there are any questions, I guess I will jump to this to the chats to see if there are any questions. Thank you. Sorry, the presentation was short. I had to just ensure that I keep it as short as possible.
Amazing. I think making it short even gives more room for questions.
Yes.
I believe we'll gain more even from the interactive sessions we're going to have now. Thank you so much, Dr. George, for the wonderful presentation. So right now we'll be taking questions. If you have any questions concerning healthcare data, I think it's the right time to ask, because we got a lot of questions around healthcare data in the previous session, and I think this is just a session where you can have better insight into healthcare data. So we have a question from Emmanuel. It's saying, do you think a research publication under the healthcare industry is complete without the vetting of health specialization or collaboration with them?
No, it is basically not complete. Usually, when I work on research papers, what I love to do is I like to bring in a medical practitioner or bounce my my decisions to a medical practitioner. So usually there must be conversation. So it's usually conversational. So I have to engage in series of conversation. I like to tell them, okay, this is what my model is predicting. What's your take about this? Try to ensure that you tie it to clinical practice. That's very, very important. So thanks so much, Emmanuel, for that question. So it is usually not complete without collaboration. So if you're in AI, just know that you're creating these technologies to aid the work of a physician and not to replace a physician.
All right, that's amazing. It's a multidisciplinary kind of process. Everyone has to be involved. Okay, so another question we're getting is, what's the process of collecting data? As someone who is interested in machine learning, how do I go about collecting data to train my model? So I think this is one of the recurring questions we'll be having, that everybody's saying there's no data in Africa, there's no data in Africa. So I think this question might address that.
Well, yes, so true. It's important. I mean, like you said, we have data in Africa. It's a wrong notion to say that in Africa we do not have data. We have enormous amount of data. I just believe that sharing is just the major challenge. A lot of researchers, a lot of establishments simply don't want to share this type of data. And of course, I can understand them, because I mean, these data sets are very are very, they're very tricky. You can't just share someone's health status. There was a colleague of mine who was working on a very, very sensitive topic. And for us to get this data, of course, you've got to go through ethical approvals and so on and so forth for you to have access to this kind of data. So just you giving your handing over the data, a patient information to you, they also don't want to be in breach. So for you to get access to this data, it helps to bridge collaboration between yourself and the medical establishment. And of course, before they can even give you such data, you've got to present ethical approvals for such.
All right. Thank you so much. So Dr. George is saying there is data, there is availability of data, but you have to go through the due process to actually access the data. Okay, so let's move on to another question here. What machine language is used for the different categories of healthcare data?
Oh, wow. That's okay. I guess you mean what machine learning language or what machine learning algorithm is used for different categories of data. I mean, it varies depending on if it's a structured data. Depending on what you want to do, you can use supervised machine learning algorithms, even unsupervised as well, or even reinforcement learning. Depends. I mean, but you mostly see that supervised machine learning algorithms are mostly being used for such data. And with supervised machine learning algorithm, you can do classification tasks, you can do regression tasks. With classification tasks, you can use the common classification models like your support vector machines, decision tree, random forest, and so on and so forth. And of course, with regression, you can use linear models linear models like your logistic regression. You can even use even linear regression. You can use survivor analysis models and so on and so forth. So depending on what the scenario is, there are algorithms that are available for you. So one thing you should do is go look up review papers about a particular problem. Then you can see the associated models that have been used for such data.
All right, thank you so much, Dr. George. Just to in that light, someone is asking, since healthcare data has different categories, how do you integrate the data to produce an AI product? So this is like translating from the model to product. Yeah.
Since healthcare data has different categories, how do you integrate the data to produce an AI product? Yeah, I mean, like you said, I mean, you've also already answered the question. I mean, if you want to integrate such data, you've also got to use the model. But the first thing you need to consider is, what do I want to solve before you create an AI product? What do I want to solve? You should narrow it down. What's the problem? What are the challenges? Are there existing technologies or existing tools that I can use? Then you narrow down the problem. Then you can basically use such data for creating the AI product. I think the product should not be the central focus. The central focus should be solving the problem, because there are so many models out there, just so many. There are so many AI models, so many AI models that can solve multiple problems. So it's important to consider, what do I want to solve first before adopting the model to solving the particular problem.
Okay, thank you so much, Dr. George. So I'll take the following questions together because they're really similar.
Okay.
Leila is asking, what's the best way forward for a current medical doctor trying to get into machine learning? And I'll take that together with recommendations, textbook courses that a beginner can go through to get skilled in AI for healthcare.
Well, That's a very, very good question. I usually get this a lot. One thing you need to do is I would encourage that you collaborate. The first thing first, collaborate. Because for me, I think I learned by doing. So many of the medical terms that I know, I get to know them from an expert. I'm not an expert when it comes to healthcare. I'm not a medical doctor. So I like to, collaborate with them, get their insights, um, present my results to them. Then we can brainstorm on the findings. Then we can either decide to write a research paper about it or, you know, basically for either for knowledge purpose and so on. Other things or other avenues, I mean, there are so many courseware. There are MOOC courses that you can take. There is Coursera. Coursera has so many courses on machine learning. Even YouTube, this platform where this webinar is being streamed on, has plethora of resources that you can use. All you just need to do, just type machine learning, and you get to get so many, like there are millions of videos on machine learning. Even aside that, if you want to go the paid for route, you can use Udemy. Udemy has so many courses on machine learning where you can upskill yourself. But it's important to collaborate. Collaboration helps you to get traction faster.
All right. I think that's really very, very important. Collaborate so that we can move faster. So I'll take these questions together because they're similar as well. One is because our data are stored using traditional method, um, and we can't access the data very, very fast to build models. So what should be done about this? And that person said our electronic health record build in Africa is very low. So there's, I think, the same thing about access to data, since we are still very much traditional and the uptake of electronic health records is still kind of low in Africa.
I mean, this was also a conversation I had with a colleague of mine, a few days ago, where we, mentioned that server costs are simply too expensive. And with servers, the pricing, I believe tech companies need to do better, especially with affordability of infrastructure to low middle income countries. And for ourselves, I believe it's important to that the organization, let's say the regulatory organization, be it the Department of Health, where you are from, need to also do better as well. These organizations should be responsible for making sure that these types of data are mostly available to the public, but they must be anonymized. That's one thing to emphasize. They must be anonymized. So such data sets must be anonymized. And of course, it also boils down on researchers. Researchers as well have data, but a lot of people have data, but they don't see the usefulness of the data. So one way you can encourage, or what I usually encourage this, is to that we need to adopt the concept of open data sharing, ensuring that once you have the data, why don't you just share it? Like, I know compensation and there are so many things that we might argue, but it's important to share. Sharing is, I always encourage sharing, because even the data set that I use for training models, I like, they are mostly secondary data. Data that was not collected by me. I don't even know the veracity of the data itself. But when I train models on it, usually, it always, to a certain extent, there is a bit of clarity in it. You can see that, oh, okay, it seems this data was collected properly. So, of course, with the primary sources of data that we have, where data is mostly being, data is being aggregated in pens and paper, that traditional method does not really help. It's important that we digitize these data sets so that, they can be used for effective decision making. Models can be trained on them, and we can carry out, basically training. We can carry out so many. We can even gain insights from the data itself. So it's important we encourage sharing. Health regulatory bodies need to also do better. Tech companies also need to do better when it comes to the African, setting. Pricing is important. I mean, the way, server costs should not be priced same way that those in the global south, global north has, because you mostly see that with the global with server costs are mostly the same. I mean, if you go to and to a certain extent, if you go to if you want to just spin up a server, let's say here in the US or even in Europe, it's comparably closer to same cost. And also indigenously, we also need to come up with our own infrastructure. It's important. I mean, Africans, we need to also do better. We need to also come up with our own infrastructure that would tailor or cater towards African needs as well.
All right. Thank you so much, sir. I think it's the right time for us to start taking up, these tasks instead of waiting on collecting all of these things from, from the donors and stuff. It's high time we put all us on deck and ensure that we start pulling our data together, start building the infrastructures that is needed for us to really leverage AI, because as we've been hearing over time, AI really fits on data. Okay, so the last question we're taking now is African data experts are building ML models, but I observe that there are less adoption in our common clinics after building. What is your advice for experts in penetrating the industry?
Wow, this is a very hard question. To be honest, this is very hard. I don't know how to answer this, but I just think it's all about like us being intentional about solving our problems. Because when you look at it in the real sense, many of our leaders are apathetic to AI. Many of them are not concerned about AI. And that's on its own, it's a problem. Like on its own, the adoption itself is a problem. If it doesn't start from the top, it becomes problematic to be adopted at the bottom. So this must start from the National Institute of Health, from the top, before it can be adopted in different organizations. So like here in the US, and mostly, countries, especially advanced countries that are first world countries, you mostly see that there is funding that they give out for non-government organizations, even educational institutions, to develop models, create your models. There is healthcare data that will provide to you. So even like NHI, I happen to be a mentor for a program called NHI Aim Ahead. And with this program, there are fundings that are provided to non-government organizations, or even private organizations, to create models that would solve problems. So like I said, I mean, it starts from the top. If they are apathetic to AI, there's simply no way that we can move forward. So we have to adopt that culture of, encouraging researchers, encouraging small organizations, encouraging non-government organizations to participate, because I mean, it takes all to fixing a problem. And I believe we are doing well. I mean, as Africans, we are doing well. I mean, if you look at the pandemic recently, we've done tremendously well. We have lots of experts. But I just believe that adoption is important. We also have to adopt. It's not just all about going with the bandwagon, but we just also got to adopt AI to a certain extent.
All right, thank you so much, Dr. George. I think that's really important. It all boils down to leadership and governance, getting buy-in from the decision makers themselves, so that we can enforce adoption across board. So, to the very, very last question about bias, considering individuals of different race, genes, and ethnicity, would the data sets we are feeding the algorithm show bias? And if there is bias, how do we correct that?
Well, thank you so much for this question. Well, I always like to not be against algorithms per se. Now, solving this problem starts from the collection. If the data is not properly collected, it can lead to bias, or wrongly collected, it can also introduce bias. So bias usually starts from the data itself. So if the data is biased, the model will spit out bias. So it's just like garbage in, garbage out. So it starts from the data set itself. So the data, our method of data collection is very important. We have to be cognizant of the fact that these models are just mathematical models. They are just trained to process the data. So the collection itself must be devoid of bias. And the fact that once it's devoid of bias, then of course it becomes easier to solving the problem. So the data collection itself, we must be trained on effective data collection, because if we don't collect data set properly, it can introduce bias. That's the honest truth. Then from there you can, once it introduces bias, there's no way the algorithm would return, an erroneous result. It's just like large language models. Whatever you give it, that's what it will give you. If you give it a wrong question, it will give you a wrong answer. So, or sometimes it will just tell you, oh, you know what, I don't understand what you're saying, or, at some point it will even do some form of correction, but it starts from the data itself. So whatever data you feed to these models must be devoid of bias. So the data itself, once the data is biased, the model will give you a biased result. I'm not sure if that's the last question.
Okay, thank you. Can I ask a question?
Yes, please.
Okay, so what I wanted to ask was that on your lecture, you have stated that how much the data that we collect from the patients, whether they're structured or semi-structured, they're very essential. They're like the core for this prediction, or for the AI, or for the machine learning. But what I wanted to emphasize was that, as you stated, that the data is very important. How much interrelated is this machine learning with the data science, as it has been stated? I don't know if you have heard it before. There is this initiative in Africa which is called the Data Science Initiative in Innovation. I don't know how the full name of the initiative. It goes with data science for health discovery and innovation in Africa. And as it has been asked before, there was you have to know the perfect prerequisites for this machine learning, so that we can be effectively know how to interpret the data, and also how to mitigate with the data that we have. So I want you to tell me how it is interrelated with the learning that
Okay, I am hearing several voices. Someone sure.
Can you mute the person speaking so that we can hear the question, please?
Mm-hmm.
Can you hear me now?
Ayob, I think the noise is coming from you.
Yeah,
Can you,
No, no.
the noise
Maybe
is coming-
Ayob, can you turn off your video? I guess maybe there might be clarity.
I have just turned off my video and I'm trying to ask a question. So,
Okay.
can you guys hear me now?
Yes.
So,
But I can hear some echo.
okay. So, how about now? Can you hear me clearly?
Yes.
So, what I wanted to ask was that there is this initiative in data science innovation in Africa, and I want to know.
I think another one just popped in. Outer and who owns the data? Hi, I think we lost Ayo.
Okay. Yeah.
So,
I can speak. I just got myself unmuted when you try to talk.
Yeah, you can proceed now.
So to provide my question clearly, what I wanted to know is that I'm a health professional, actually like a nurse who find himself uh, with with a lot of money problems in the health sector, so that can be solved through this AI. But what I want to know is that what are the prerequisites for this machine learning and how much it is integrated with the data science, so that I can encounter the lots of data science initiatives in Africa. And
Okay,
I
Ayob,
will,
I'm so sorry. I unfortunately cannot hear you clearly. If I were to maybe pick up a few things that you said,
type it on the
I believe
chat.
we can take this conversation offline. Maybe you and I, we just meet maybe to go over your question, or you can also type your question on the chat so that we can I can get clarity of the question itself.
All right. Thank you, Dr. George. Can you hear me now?
Yes.
All right. So, Ayo, please type your question in the chat session, and we can always send you a response even after the session. So, to the last question, I will round up. So, we have somebody asking about the individual rights to healthcare data, who owns the data, and how do we protect the rights of the individuals behind the data and prevent digital colonization in relation to AI in Africa? That will be the last question. Thank you.
Okay. How do we protect the rights of individuals behind the data? One way to, like in my presentation, I mentioned anonymizing the revealing information in the data set, like the name of the patient and all that information, even the address of the patient, and all the identifying information of the patient. It's very important that one conduct is very important. Then and how can we prevent digital colonialism in relation to AI in Africa? Well, the concept of digital colonialism, I mean, it still boils down on the fact that we have to come up with our own infrastructure. As Africans, we have to, even if we don't have the infrastructure, let's come up with legislation that supports African needs. I mean, currently, it's important, for us to acknowledge that, we simply do not have an AI Act. This legislation are very important. The EU, they are a frontier with respect to this. Even GDPR, most of our own legislation like your NDPR, Nigeria Data Protection, even POPI, were built under the framework of the GDPR. It's important that we consider African needs when creating these technologies, when coming up with legislation that supports these technologies. Remember, as a continent, we are very diverse. We speak virtually several languages. And the fact that, we speak several languages, it's important for us to consider African perspective when creating legislation. It's fine, we can obviously tailor most of our legislation under the more formalized structures like your GDPR, HIPAA, and so on and so forth. But I believe that we should still come up with legislation that supports African needs. It's very, very, very vital. Same way, HIPAA would have its own that supports, the US needs, and GDPR supports European needs. You cannot, in fact, if you're processing any information, you cannot process any European data without, not even one single line without having to get authorization for that. So similarly, we should have all those legislation put in place.
Okay, thank you so much, Dr. George. This has been such an insightful session. We've explored the power of data to revolutionize healthcare delivery in Africa. So I'm really grateful to everyone who has joined this session. We hope you got value for your time. But our journey doesn't end here. In fact, it is just the beginning, because we believe that with the knowledge and insights we've gained today, every one of us, we have the power to be a catalyst for change in our own community.
Hello, everybody. I think we're losing Vivian, and I think I will take over from her. My name is Dorcas. I'm from DHA. As I was saying, I'm Dorcas from DHA, and I'm going to take over from Vivian. I hear we're losing her. So I wanted to thank you, all of you, for joining in this evening. Vivian, can you hear me? We're losing you. So I wanted to thank you, all of you, for joining in today. And I saw a question on the chat about whether there's like a WhatsApp group where they can get information. And one of us has shared a LinkedIn page.
So our challenge to you today is to take what it is to advocate for better data quality, raising awareness and advocacy act for policies to be made around adoption of that. And I believe that together we can build a fifth goal to train our AI models, to further. So I'll give sorry about that. Can you hear me now?
Vivian,
Yes.
what's going on? You're replaying yourself. Vivian, what is going on? Oh, Jesus. So frustrating.
Yeah, technology.
Yeah, exactly. She's replaying the way she's laughing. I'm just Vivian, are you there?
Hello.
Yes. Can you hear me now?
Why are you replaying yourself, Vivian? Yep, we're hearing you.
I'm so sorry, my internet got messed up.
Vivian, are you there?